Hi and welcome to the studio, Christopher.
Thank you, Kaisa.
So you just released your financial report for the fourth quarter and you didn't report much sales this quarter. How come?
That was definitely expected. The sales in 2018 were a legacy of having a consultant agreement for the development of our corn fiber extract prebiotic product. And obviously we didn't have those sales in 2019 because it was a transition year of bringing that IP into the company and working with the enzyme development work, working with the transition from our first generation platform to our second generation platform, and then sort of ramping up our therapeutic development activities as well. So definitely sales and losses in this case were definitely in line with which was expected and budgeted as well.
I understand. Can you also briefly summarize the last quarter for me?
Yeah, the last quarter was good from a business development standpoint. If we look at the this LinkGut partnership model, which is essentially how we distribute through a white label service, our OneGut platform. There we signed 2 agreements essentially, one with a Swiss company, Gabriel Pharma, and a second with an Irish company working with digestive health optimization. And so that was very good from our standpoint. Obviously, the listing of the company was a big big event as well, and definitely a milestone in the company's development. So I'm overall very pleased actually, and I'm definitely pleased as well with the on the staffing side, the people that we brought in, and we have a good solid team in place right now to execute on our ambitions.
Let's talk a little bit about the project in Switzerland with Gabriel Pharma. How's things going there?
Yeah. The intention of that project was to have sort of an internal pilot study where they could sort of get exposure to our platform and then use that as an inspiration to develop ideas around how we can create a model where we distribute this type of diagnostic platform, which we offer today through pharmacies. So it's still in an early stage, that project, and yeah, definitely looking forward to scaling up that type of activity, and not only limit that to the Swiss market, which was in this case, but also look at the opportunity of applying a similar model in Sweden and in other countries as well. Because this is really about how do you create distribution channels for this type of service. And it just so happens to be that we have positioned this product as a white label service, which means that we can offer it to any food and beverage company, any type of nutraceutical company, supplement company, health and wellness app, dietitian, or a medical professional. And costs nothing to set up, and they earn a commission on this as well.
Exciting. And you've also now launched the second generation diagnostic platform for gut health. So what does this mean for Carbiotics?
I think it means a lot for Carbiotics. I think it means much more for the industry in general. It's truly a transformational platform in the sense that our first generation platform wanted to validate the rationale of taking many samples over a longer period of time to get a better understanding of what's happening in a person's gut microbiome. Because of that, we recognized the need for multiple samples, and to accomplish this, you have to bring down the price. So we spent a lot of time and effort over 2 years to bring the price down, whereas others have never had that incentive. So now when we moved over to this next generation sequencing platform, we can apply these same cost savings in this new environment, new analytical environment. And because of that, we can offer the same test, but now with 3 samples. And there's no scientist out there that would say that 3 samples is not better than 1 sample. So we offer a triplicate sample, and we even offer 6 samples for those who are interested, and the ability to look at it every single week if someone's very interested in understanding their baseline gut health, and then deciding how often they should do this as well. So this is, again, transformational in this industry, and we're targeting an industry which is about 800 million euros with a technology which is on a per sample basis, 1/3 the cost of the nearest competitor, and that competitor is a non-profit. So if we look at the average cost of our competitors, it's about 1/5 the cost.
I see. And you're also undertaking a study with the University of Verona. Can you please talk a little bit about this?
Yeah, that's a good example of how we can leverage the platform nature of our technology. And there, that particular group, they're working with different neurological diseases, and there we sort of set up a project looking at neuroinflammation and the link between gut health and neutrophils, which are these biomarkers not biomarkers, but hallmarks of the onset of different neurological diseases. So that's a study that will be ramping up, and a partnership will be ramping up as well.
And when can we expect the results from this?
Well, obviously we said that Q2 is when we want to carry out these studies as well as the other studies. That's been communicated thus far. And it always takes time to synthesize the results, etc., from those studies. So the results usually come the quarter afterwards, and that applies to, for example, the Food Marvel project and our work with others as well in the field. But I think that's a good example of the fact that we've been very exposed to different opportunities, and we're very open as well to forming partnerships with academia, exploring different indication areas. And it really shows the platform nature of our technology, in the sense that we are a company that is improving gut health, or improving human health through improving gut health is the easiest way to explain it. And that means essentially there's a link between obviously gut health, or the human microbiome, and the onset of many different metabolic and chronic diseases, neurological diseases, gastrointestinal, oncology related, etc. We know that also that 70% of the immune system sits in the gut, which is a very relevant issue today, obviously. So if there's a proxy out there for immune system integrity, gut health is certainly that. Although there is no definition of what gut health is. It's a relative concept to each individual. And therefore that justifies the need to measure even more and compare yourself over time, testing different interventions and seeing what can produce these key metabolites, which we know are key to maintaining the integrity of this gut health mucosal layer.
Does sound like an interesting topic, but looking forward, where is your focus for the upcoming quarter?
The upcoming quarter is obviously because we launched our Gen 2 platform, which is one of the cornerstones of one of our verticals. It's ramping up marketing activities in connection with that. We know that there'll be naturally deniers out there who don't really see how we do this, but that's fine. That's one of the phases in launching a transformational type of technology. Obviously, we're making strides when it comes to our ingredient, this corn fiber extract Axis, and that's something that is extremely interesting. And what hasn't been communicated is that we've done the enzyme work, but we've also done the process optimization work. So now it's about moving quickly forward with the regulatory work and the scale-up work, and we definitely have discussions in place in connection with both of those areas. And that's a large market. That's a 50 billion crown opportunity, and we have a product which is up to 10 times better at a similar price level. So that's a very interesting opportunity. And obviously on the therapeutic development side, it's moving forward with the studies that we've communicated, and it's about doing things more efficiently, I would have to say. And that's constantly under evaluation in the company. If we see opportunities to cut steps out of a process and get closer to market, to reach sustained profitability closer, we'll do that in all of our verticals. We won't compromise our competitive advantage. We'll try and leverage that and exploit that. But regardless if it's on the diagnostic side, which we're at market now with an extremely compelling offering, if it's on the ingredient side, which we're pushing forward very quickly, or if it's on the diagnostic side, where we're looking for opportunities to bring products quicker to market that will have a positive impact on people, we will pursue those opportunities. Yeah, exciting times ahead, it sounds like. Very much so. So before we wrap up this interview, are there any important dates that investors should look out for with regards to Carbiotics? Yeah, definitely. We have our AGM on the 24th of April. I think that's a good opportunity for our investors to come and ask us questions. We definitely look forward to those occasions. We think that education is something, generally speaking, all companies should do, and we haven't done the best job in that area, simply because we're working with quite a complex area, and we have, as I said previously, three companies in one company. So the challenge is even more so to explain what we're doing, and we're trying to do that in the simplest way possible. And as I said earlier, we are our company working with improving human health to improve gut health, and then from that we can explain the different areas we're working with. And so I definitely welcome investors to join the AGM. Well, thank you for coming to the studio and answering my questions. Thank you, Kaisa.